You think when you ignore cavities, it will go away on their own. To answer this, we first need to understand the difference between a cavity and a precavity, also known as incipient decay. A cavity is a permanent damage to the tooth that occurs when tooth decay has progressed beyond the enamel. Sadly, cavities won't pack their bags and leave on their own. They need professional intervention. On the other hand, a precavity is the early stage of tooth decay. It's when the outermost layer of the tooth, the enamel, starts to diminish. But here's the good news. Precavities can be reversed, yes. You heard it right. With proper home care, which includes thorough brushing and flossing and using a fluoride rinse, you can actually stop and even reverse this early stage of decay. So to answer the question, cavities can't go away on their own, but precavities can be reversed. But how can precavities be prevented or reversed? Let's dive into the importance of flossing and fluoride use in this process. These two are the dynamic duo, the superheroes of oral hygiene, swooping in to combat precavities. Flossing isn't just about removing that pesky piece of spinach from lunch. It's about dislodging hidden food particles and plaque, preventing the formation of cavities. Then comes fluoride's part. It's a natural mineral that helps repair the early stages of tooth decay and makes teeth more resistant to acid attacks from plaque bacteria and sugars in the mouth. Your dentist might recommend specific fluoride products or techniques depending on your oral health situation. One method is the fluoride toothpaste on floss technique. Here you apply a small amount of fluoride toothpaste to your floss before using it. This ensures that fluoride gets directly into those hard-to-reach spaces between teeth. My hot tip is to use a fluoride mouth rinse after brushing. Remember, flossing and using fluoride are crucial steps in preventing and reversing precavities. But what about regular cavities? Once a cavity is broken through the tough outer layer of your tooth enamel, it's a whole different ballgame. At this point, the cavity is here to stay. It simply can't reverse itself or go away on its own. You see, the enamel is like a protective shield for your teeth. But once that shield is breached, the cavity has a direct route to the softer, more vulnerable parts of your tooth. This is where the true danger lies, because without intervention, the cavity will continue to eat away at your tooth, causing further damage. Now, you might think that you can spot a cavity just by looking in the mirror, but unfortunately, that's not always the case. Dental x-rays are often needed to detect cavities between teeth, places that are hidden from plain sight. Even a visual inspection by a dentist may not reveal the full extent of a cavity's progression. This brings us to the importance of proper treatment. The longer you delay treating a cavity, the more complex, and yes, more costly the treatment becomes. If a cavity is caught early enough, it can often be treated with a simple filling. But if left untreated, it can lead to more extensive and expensive procedures like root canals or even tooth extractions. So this is the takeaway. Delaying cavity treatment leads to more extensive and expensive procedures. So it's crucial to treat cavities as soon as they're detected. So how can we avoid cavities in the first place? The answer is simple: good oral hygiene. Brushing and flossing daily disrupts plaque biofilm, which is a major culprit behind cavities. Not to mention a whole food plant-based diet. Regular use of fluoride products is recommended. Especially if you're prone to cavities, fluoride strengthens teeth, making them more resistant to decay, and kills the bacteria. Now let's talk about routine dental checkups. They're not just a formality. Regular checkups, ideally every 6 months, are crucial for early detection of potential problems. Routine x-rays can identify hidden issues that may not be visible to the naked eye. They also help identify areas that need extra cleaning at home and potential cavities in the incipient stage. Now let's clarify a common misconception. Incipient decay, often mistaken as a cavity, is not a true cavity. Think of it as a warning sign. It's the demineralization stage of tooth decay, but it's reversible. On the other hand, once a cavity is formed, it's irreversible. The tooth structure that's lost cannot regrow. It's scientifically impossible. So if you suspect a cavity, it's best to see a dentist promptly to prevent further damage. Remember, prevention is better than cure. Regular dental checkups, good oral hygiene, and a sensible diet go a long way. And that's a wrap on the truth about cavities. Remember, precavities can be reversed with good oral hygiene and fluoride use. But once a cavity forms, it's here to stay. If you found this video helpful, don't forget to like, subscribe, and turn on notifications. Stay tuned for more informative videos.